Hi, my name is Dr. Dulcie Wanda, a clinical and radiation oncologist. Thank you for coming here for the discussion on cancers. I am happy you're here, and today we're going to talk about chemotherapy. It's the word that everybody hears when they think about cancer, and I think most people, when they hear the word chemotherapy, they're frightened. They think it's this very horrendous animal that's gonna make their patient not do well, make you very sick. So today we want to talk about what is chemotherapy, how does it work, what are some of the side effects one gets, and why do we get the side effects, and the types that are available. So let's start. What is chemotherapy? So these are drugs that enter your system. They enter your body. Either you take them orally through the mouth, they undergo digestion, and they enter your blood circulation. They can also be administered through the vein, and they get to your blood system. They can also be administered maybe through the peritoneum, which is within the stomach. There's a lining that holds the intestines and everything there. It can be given intraperitoneal. Sometimes chemotherapy can also be given intrathecal, that is through the back to enter the spinal canal where there is spinal canal fluid, cerebral fluid. That's possible. So the whole thing to know is these are drugs. They are drugs that are strong, that enter your system. So having said that, how do they work? When we talk about cancer, remember we said they are rapidly dividing. The rate of division of a cancer cell compared to a normal cell, the cancer cell is very rapid. It evades the immune system. It makes its own blood vessels. It's able to break off and go to other organs. That's what a cancer cell is. So chemotherapy targets fast replicating cells, the cancer cells. However, the normal body also has fast replicating cells. For example, the hair. If men, when they shave their beards, they'll tell you within a day or two, then it's already resurfaced because it's fast replicating. Then we also have the mucous membrane, the mouth, from the mouth, the inner aspect of the mouth, the lining around the mouth. When you swallow down your esophagus to your stomach, to your intestines, all the way, the gastrointestinal system, where food passes through, gets absorbed, and eventually is eliminated. So those mucous membranes are also fast replicating. How do you know that? If you bite yourself, then it doesn't take very long. After a few hours or a day, that painful area has resolved because it's fast replicating. The other thing that's fast replicating are your nails. So when you cut off your nails, then over some time you'll notice that your nails have grown back. So as the chemotherapy targets the cancer cell, it will also target these rapidly dividing cells. And that explains some of the side effects a person would have. So it's killing the cancer cells, but it will also affect your hair, meaning you may lose your hair depending on the chemotherapy you get. And the hair loss is the whole body. Wherever you have hair, you'll be able to lose your hair depending on the type of chemo you're given. It's not all chemotherapy that makes you lose your hair. Some do. Another side effect, you might get mouth sores. Remember we said the mucous membrane is fast replicating. You bite yourself, it heals very fast. So you might find you have a bit of ulceration in your mouth after chemotherapy because those cells have been targeted. Your nails, it's possible to notice that there'll be lines signifying every chemo you get where there's a bit of stunted growth and then the nails grow up. So if you notice discoloration of your nails, it's something you should not worry about. That's a side effect that's common to chemotherapy. Nausea and vomiting, the irritation of the gut happens. Remember, the mucous membrane is all through your stomach, your intestines, all through up to the exit of the waist, which is the rectum. So you might have a bit of bloating, abdominal discomfort, loss of appetite. Some of these chemo drugs also act within the brain. We have the nausea trigger center where you feel like vomiting, and that can be triggered with chemotherapy. So having a bit of nausea and vomiting is something that is expected. There is fatigue, feeling tired, that comes with chemotherapy that has been observed by many patients. Another thing is sometimes you may have fogging of thought. The thought process and the clarity of your thoughts might be a bit fogged. Sometimes it's referred to as chemo brain. That means you have a bit of fogging. So how do you cope with these side effects? Because that's what is really scary. I think we've come a long way. If you look at how chemotherapy was given 20, 30 years ago, then it was really horrendous. Patients would be vomiting as they get chemo. They would be very sick. And I think that's what everybody thinks about. But we have done so well. There are drugs that are working so well to control the nausea and vomiting. It is possible for you to get chemotherapy and you don't experience vomiting. There are patients who've gone through their cycles and they've never vomited. That's because of the drugs we have. They can control the vomiting. So we give medication before we give you chemo. Sometimes we even add some of the medication during chemo to reduce the nausea, vomiting, and discomfort. We give you something to reduce the bloating so that you don't have excess acid production. And even after chemo, there are medications you will go home with to take, one, to reduce your nausea and vomiting, to reduce the side effects that you may get with chemotherapy. The hair loss, which can be at times very dramatic, is reversible. So of note, not all chemotherapy drugs will make you lose your hair. It's good to ask your doctor, will this chemotherapy regime make me lose my hair? So that you're psychologically prepared to know whether you'll lose hair or not. So if we talk about some of the problems that can happen with hair, one, your hair may thin out. So it's not as densely populated as it was in the past. You may lose part of your hair, meaning you have like some moderate amount of hair loss, or it can be very dramatic where you lose all the hair in your body, which includes your eyebrows, will include hair in your armpit and even in your pubic area. So majority of the hair loss that is gotten after chemotherapy is reversible. Many people after 3 to 6 months they'll notice hair coming back. The initial hair that comes back is softer, curlier, and sometimes even has a change of color from what you had before. But over time, between 6 to 12 months, majority of people who've gone through chemotherapy have their hair back. So how do you prepare? What should you do if you know you're starting to have chemotherapy? So one, get to know whether the chemo you're getting will cause hair loss. Because if it will, it's good to prepare for it. Some people opt to shave hair before they start chemotherapy. They do not want to have that experience of touching hair and see it falling off. They feel that would be traumatic for them. That could be a start. Others decide to shorten their hair, so they have like a total change. So if their hair was long, they cut it short, sometimes change their whole hairstyle, so that people are sort of getting used to them with short hair. By the time they have total hair loss, then they're more comfortable. Having a wig, or what I call girlfriends, is a good thing because that will help people just get used to you having a wig on. It will boost your self-esteem because you will not have to discuss why you don't have hair if you're not ready for that discussion. And that has helped. So getting a good wig is good. And as you get a wig, it's important to have a wig cap. Why are we talking about? The scalp can get sensitive. After you've had hair loss, remember you're not used to having your bare scalp. So it's good to have a wig cap on and then wear your wig so that it helps you deal with the rough texture of the wig, and also helps to keep the heat away. So a wig cap is important. I always recommend if you can have also an eye pencil so that you can draw your brows and people can be able to see your eyebrows so that it's not very dramatic. You had eyebrows before and now you don't have them. So you can start that before you start chemotherapy so that you're used to how you draw your eyebrows. The other thing to note is that if your scalp is dry and flaky, then you can apply water-based ointments on the skin. They are normally very friendly for the scalp and they won't cause irritation. Another thing to do is to keep your head warm. Remember, this is a totally new experience. Perhaps you're used to hair and now you have a bare scalp. So the discomfort of the cold can be quite nerve-wracking. So keeping the head warm is something that's there. So having scarves, having caps, or different things to cover your hair, your head can go a long way in helping you deal with the hair loss. Why does one get chemotherapy? There are different indications for chemotherapy. So one, you can get chemo immediately you get a diagnosis before any other treatment. For example, for breast cancer, you can get chemotherapy to shrink the tumor before we do surgery to remove the tumor. So that we call pre-operative chemo, before surgery. You can also get chemo post-operative, meaning you've gotten treatment such as surgery, you've gotten treatment, maybe some radiation, and then now adjuvantly, as an add-on, we give you chemotherapy. Chemotherapy can also be given in terms of metastatic disease when we want to control the severity of the disease. So if you have maybe colon cancer that is in the lung and in the brain, and we want to control the disease, we might be able to mix some of the treatment options. We might give you radiotherapy to deal with the lesions in the brain, and then chemotherapy to deal with the bulk of the disease that has gone systemic. Remember, chemotherapy is systemic. It gets into your blood and goes to your whole body. So that's how chemotherapy is given. Those are some of the indications. So, does everyone get the same chemotherapy? No. Chemotherapy is not a standard regime for every cancer. All cancers have their own regime, and even within one cancer, for example, if it's cancer of the breast, there are several types of medication that you can get. So what determines the type of chemotherapy you get? One, it's the disease that you have, the cancer type that you have, it's immunohistochemistry. What is the breakdown of that cancer itself? What will it respond to? That cancer itself, that determines. Also the age, the other diseases that you have, we call them comorbidities. So you may have cancer, but you have diabetes. You may have cancer, you have heart disease. You may have cancer, and you also have hypertension. So we look at a person in totality. What do you have, and how will the drugs we give you interact with the other conditions that you have? Your age is also a consideration, the type of drugs that you want. Your fertility options also sometimes contribute to our decision on which drugs are we be able to use to treat you. Then it's also based on your height and weight. So it means each dose is tailor-made for a person. We cannot exchange chemotherapy drugs and say, since all of you have breast cancer, I will give you the same dose. No. So how do you prepare for chemo? So once a diagnosis has been made of cancer, you will see your oncologist. The treatment options will be prepared for you, and you will be given an opportunity to consent, to say, I am okay with this treatment that you have put me. Most of the time, the consent is done in terms of signature. You will make a signature, or you will give consent verbally to the patient. To your doctor, majority, it is good to sign that you have accepted to have chemotherapy. So after you have given consent, you have understood the side effect profile, you have understood the drugs that you're being given, then now you will be ready to get chemotherapy. But before that is done, we need to know what is your level of blood. So we do what is called a full hemogram. We will do a kidney function test, a liver function test, and other array of tests that we consider baseline before we are able to prescribe the chemotherapy. Once the chemotherapy is prescribed, if it's tablets, it will be administered to you. You will be explained to the schedule, which foods to avoid, which foods to take, whether to take it before or after meals. If it's an infusion, meaning it's a liquid that's put through the vein, then it will be done in an oncology center, in a hospital facility or an oncology center, where it will be administered by professionals. We have professionals in oncology. There's the oncologist who will make the prescription. There's the oncology nurse who will oversee the administration, and we also have oncology pharmacists who will be able to mix and prepare the medication that you're supposed to get. So in an oncology center, it's a teamwork. We work together. The counselors are in place, the nutritionist, the social worker, and with that team, you will get adequate preparation for your chemotherapy. So of note, chemotherapy administration is painless. Be it the tablet you take, you will not experience pain while taking the tablet. When you get the infusion, perhaps the only pain you might feel is when we are putting the IV line, but it is a painless procedure. You do not feel pain as chemotherapy is being administered. It is just the way you would get maybe IV fluids put you in case you're dehydrated. It is a painless procedure. So that's just an overview of chemotherapy. It's been lovely being here with you. Let's talk more about cancer.